Could L-Citrulline be the hidden tool for improving erections? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to talk about how L-Citrulline works, what the research says about how effective it is, and what possible side effects you should know about. Before we dive in, it's important for you to know that there are excellent medications available today that are quite affordable and can be prescribed by your doctor for erectile dysfunction, such as sildenafil and tadalafil. If you'd like to learn more about these options, be sure to watch my earlier videos where I explain them in detail. Erectile dysfunction is extremely common. In fact, about 52% of men over the age of 50 will deal with difficulty getting or maintaining an erection when they try to have sex. The most frequent reason for this problem is reduced blood flow to the penis, often caused by vascular conditions such as high blood pressure, diabetes, and high cholesterol. If you've followed my channel before, you know that one of the most important chemicals involved in erections is called nitric oxide, often shortened to NO. This chemical is produced by specific nerve endings in the penis, and it signals the blood vessels to create even more nitric oxide. That nitric oxide then binds to proteins within the blood vessel walls, allowing the vessels to widen, a process known as vasodilation. When this happens, the smooth muscle in the penis relaxes, blood flows in more easily, and an erection occurs. As I like to say, nitric oxide acts as the ignition switch for your erection. So where does L-Citrulline come into the picture? The reason I'm discussing nitric oxide is that L-Citrulline can indirectly raise nitric oxide levels. It's an amino acid naturally produced in the body and also found in certain foods, especially watermelon. The challenge, however, is that L-arginine is often broken down quickly by enzymes in the intestines and the liver before the body can fully use it. L-Citrulline works a little differently. Instead of being broken down early, it is converted into L-arginine inside the kidneys. Because of this pathway, it bypasses many of the enzymes in the digestive tract and liver that would normally destroy L-arginine. There's also some intriguing research suggesting that L-Citrulline may encourage the muscles in the penis to release a substance known as vascular endothelial growth factor, or VEGF. This factor helps improve the function of blood vessels and may even support the formation of new, healthy blood vessels, or restore blood vessel function in the penis. From a physiological standpoint, it sounds logical that it could help. But the real question is, does it actually work? Back in 2011, researchers studied 24 adult men who had mild to moderate reductions in penile rigidity. In simple terms, these men were still able to achieve penetration, but the erection wasn't firm enough to be satisfying, or they were unable to complete intercourse. To measure this, researchers used something called the erectile hardness score. On average, the men in the study had a score of 3. The participants were then given 1.5 grams of L-Citrulline per day, split into 2 doses, 750 milligrams each time. What's interesting is that every participant served as his own control. During the first month, the men received a placebo, although they were not aware it was a placebo. In the following month, they were given L-Citrulline. The results were quite interesting. In the L-Citrulline phase, about 50% of the men experienced an improvement in their erectile hardness score, increasing from 3 to 4. A score of 4 means the penis becomes completely firm and fully rigid. By comparison, only about 2% of men experience the same improvement while taking the placebo. So based on this very small study, it appears that L-Citrulline may provide some benefit for men who have very mild erectile dysfunction. In other words, men who can still get an erection, but it's not quite firm enough or it doesn't last long enough. That being said, this was a very small study, so the results should definitely be taken with a grain of caution. The encouraging news is that L-Citrulline appears to be relatively safe and tends to cause very few side effects. However, one major issue with supplements in general is that they are not tightly regulated. Because of that, we can't always be certain that what's written on the label is exactly what's inside the capsule or powder you're taking. More importantly, Rather than only trying to treat erectile dysfunction after it begins, it's much better to focus on preventing it in the first place. Maintaining a healthy diet and staying physically active can help keep your blood vessels working properly, and that supports stronger, healthier erections. Thank you so much for watching. If you found this video helpful, be sure to subscribe. As always, remember to take good care of yourself, because you truly are worth it.